Of today, this day also a great reminder about the most important muscle in our body, the heart.
Heart disease continues to be a leading cause of illnesses, but the good news is that it is preventable with the right actions.
Joining us to tell us more today, Dr. Heather Swales, Medical Director, Co-Director of the Women's Health Program at Hartford Healthcare. Thank you so much for being with us this morning. And how does Hartford Healthcare help patients understand and improve on their heart health?
Hi, good morning.
Good morning.
So we have a lot of outstanding cardiologists with multiple subspecialties in cardiology, with specialty clinics in women's cardiovascular health, postpartum hypertension, hypertension, peripartum cardiomyopathy, lifestyle medicine. In addition to the kind of bread and butter types of cardiology, so we have a lot of resources to help patients get on track with their health, especially when focusing on cardiovascular health.
Wonderful. What are some common risk factors for heart disease?
So the most common ones are things many people know about, but just as a reminder, things like high blood pressure, high cholesterol, diabetes, smoking. Those are all things that lead to cardiovascular disease. But other things that people may not be aware of is things like a sedentary lifestyle. So if you're not doing regular physical activity and exercise, if you have poor sleep, if you drink alcohol in excess, there are certain risk factors specific to women, like preterm birth or frequent miscarriages, that can also be predisposing risk factors for heart disease.
And Hartford Healthcare really has a team approach when it comes to the prevention and treatment of heart disease, correct?
Absolutely. So especially with our new lifestyle medicine program that really helps to focus patients on what they need to do within their day-to-day life to reduce their risk and control risk factors. We have a behavioral health psychologist that can help people identify what obstacles may be in place, or when they're struggling with the mental aspects of dealing with chronic illness. That can be a really great resource. We have very strong cardiac rehab program that can help people recover from cardiovascular surgeries or other cardiovascular procedures. So when we combine all of that together, I think we really can provide the whole package to help people get on the right foot.
Absolutely. And quickly, before we let you go here, Doctor, what are some steps that individuals can take today to improve their heart health?
So I think number one, make sure you are seeing your primary care or your main healthcare provider on a regular basis to make sure those risk factors that I mentioned, like your blood pressure, cholesterol, diabetes, are in check. Getting rid of the cigarettes, minimizing the alcohol intake, trying to focus on healthy sleep hygiene are important. And then, of course, eating a heart-healthy diet and getting enough exercise all is very important.
Yes.
All right. Doctor, thank you so much for being with us this morning.
Thank you for having me.